Since last Wednesday, there has been a slight increase in our leading indicators, the positivity rate on PCR tests and virus levels in wastewater. The wastewater from data from Tuesday, March 29th and Monday, April 4th shows there is more virus circulating in a number of areas. It's not a spike that we saw in late December and early January. And in some centers, we're seeing the data fluctuate around a level that's in between the extremes of the past few months. So it's a concern, and we're monitoring it closely. But it remains to be seen how much more increase we'll see, and in particular, how that will translate into serious illness and hospital admissions. Dr. Hinshaw will provide detailed numbers in a moment, but over the same period, the average positivity rates of PCR tests has been about 26.3%. That is a slight increase from 24.5% that we reported last week. We've also seen the numbers in hospitals hold fairly steady, with a slight increase to 990 compared to 964 last week. However, patients in ICU have also decreased slightly. We can expect some increase in admissions over the next few weeks, but we're well positioned to manage it. First, we have strong protection from our high level of vaccination and from exposure to the initial Omicron wave about 3 months ago. And second, our health system is heading into April with total numbers of admitted patients that are within normal levels for this time of year. The people who work in our hospitals are under strain from 2 years of COVID, no question, and I thank you again for their continued efforts. But the numbers of patients overall are within our normal bed base. Overall, hospital occupancy is currently around 90%, depending on the day. That's similar to the same time of year in the 5 years before COVID. A few of the big sites in Edmonton and Calgary are over capacity, but that is also in line with our experience prior to COVID. The other sites in the two big cities are within their normal bed base and at similar occupancy levels to the 5 years before COVID or lower. The 5 regional centers are also in line with pre-COVID levels or lower. In Red Deer, for example, total inpatient occupancy has ranged from 85% to 95% over the past week. The average is about 90%, which is a bit lower than the same time of year in all 5 years before the pandemic, 2015 through to 2019. The system is delivering near normal volumes of surgery compared to recent years, and the total surgical wait list continues to decline slowly. Most recently, the list was around 74,000. Now, for context, it was close to 77,000 at the beginning of March of this year and about 68,000 in February 2020, just before the pandemic started. And this is still, however, far too high. Now, we can expect some increase in virus circulation as we get back to more normal life, and we can expect some increase in admissions, and our healthcare system has the capacity to manage that. But I also want to emphasize we're continuing to work to protect Albertans and minimize any further strain on our healthcare system. We're maintaining protective measures in continuing and acute care, and we're continuing to promote vaccination, invest in treatments like Paxlovid, and encourage individuals to make decisions that best suit their unique situation and risk tolerance. Yesterday, in line with the National Advisory Committee's recommendations, we expanded eligibility for 4th doses to all residents in seniors' congregate care facilities, and anyone aged 70 and older, no matter where they live, as well as First Nations, Métis, and Inuit people aged 65 and older. The expansion means that more than 400,000 Albertans will soon be able to get an additional dose to increase their protection from COVID. Throughout the pandemic, older people and those with serious immunocompromising conditions have been at a greater risk for severe outcomes from a COVID-19 infection. That's why we've prioritized their access to vaccines from day one and why we're making 4th doses available now. Starting next Tuesday, April 12th, appointments for 4th doses can be booked through the Alberta Vaccine Booking System online by calling 811 or contacting your local pharmacy directly. As with previous doses, a minimum of 5 months must have passed since your 3rd shot. We're also making 4th doses available to Albertans who require them for travel purposes. To be clear, fourth doses are not clinically recommended for the general population at this time. So we remind people to please follow the criteria that are in place, as they've done throughout the pandemic. We continue to monitor the evidence and make adjustments to eligibility based on the data and based on expert advice. That being said, I continue to encourage Albertans to get every dose that they are eligible for. I know there are some Albertans who've been waiting for more non-mRNA options. So I'm pleased to announce that Alberta is set to receive 10,000 doses of Novavax Nuvaxovid. Starting April 12th, interested Albertans who are 18 and older can call 811 to book an appointment for Novavax. The best protection against COVID-19 continues to be vaccination, but we're fortunate that we also have antiviral treatments as another tool. Paxlovid has proven effective in preventing serious infections in high-risk patients with mild to moderate symptoms, including those infected with Omicron, both BA1 and BA2 subvariants. We've also expanded eligibility for Paxlovid to include First Nations, Métis, and Inuit people 45 and older who are unvaccinated or who have received one dose of vaccine, and all individuals living in continuing care regardless of their vaccine status. And of course, people with immunocompromising conditions continue to be eligible as we previously announced. More information on eligibility and how to access treatment is available online. I also want to remind Albertans that we continue to have measures in place to limit transmission and protect the most vulnerable. Those include mandatory isolation for those who have COVID-19 symptoms or who have tested positive. If you're sick, you must stay at home. Masks remain mandatory in acute and continuing care settings and on public transit, and this will continue until further notice. And we continue to make rapid tests conveniently available across our province. I want to thank the millions of Albertans who continue to do their part by getting vaccinated with every dose they're eligible for and staying home when they're sick.